My name is Birinderjit Kaur and my ID number is 1630512220. So before I am here to do the head to toe assessment. Before starting the assessment, my friend will do 360 angle of the room. I am going to start my head to toe assessment. So before start the assessment, so I'm gonna introduce to my patient. So I'm your nurse. I'm here today to do your head to toe assessment as per the doctor's order. So before starting the assessment, I quickly do my hand sanitize and put the gloves on. And maintain the privacy and put the curtains on. What is your name?
My name is Harpinder Kaur.
Okay, can I see your ID card, please?
Yes, sure.
Okay, can I know your date of birth, please?
It's 22 March 1996.
Okay, so the information that patient gives me is matched my documents. So after that, we will start from the pain. Do you have any pain right now?
Yes, I have.
Where?
In my head,
Okay, on which side of your head?
right side of the head.
Okay, how long you pain this?
From last 4 hours.
Okay, does this pain rotating or on the same place?
No, on the same place.
Okay, so if you have to rate this pain 0 to 10, what would you give the rate?
3.
Okay, does this pain affect your daily activities of living?
Yes, it affects.
Okay, so can you can I note down your information?
Yes, sure.
Okay, so my patient has the pain in her left side of the head, and she rated at 3 out of 10 her pain. This pain affects the daily living of my patient, and she rated 3. And so I measure this pain at with the help of the PQRSTU method. So after that, I'm gonna do my further assessment, that is neurological. To start the assessment, I just check her conscious level. To check the conscious level, I have some question that I'm gonna ask from my patient. So what is your name?
My name is Harpinder Kaur.
Okay, where are you?
At my friend's place.
Okay, how you came here?
By myself.
Okay, is it day or night?
It's a day.
Okay, what is the date today?
It's Tuesday.
Okay, so can I know your date of birth, please?
It's 22 March 1996.
Okay, these things shows that my patient is fully oriented and conscious about the time, place and people. So after that, I will check her cranial nerves, that are 3, 4, 6 and 7. Here I'm gonna explain the name of the cranial nerves, that is oculomotor, tragular, abducent and the facial. So first 3 nerves I will check together, and the last one I will check in the last. So to check it, firstly you have to focus on the instructions that I am going to give you, and you have to see on the tip of the pencil, and I will move the pencil. Just keep in mind, you have to move your eyes, not your head, with the movement of the pencil. Okay?
Okay.
Okay, can you please close your eyes, open your eyes. Okay, after that I will check the confrontations. To check the confrontation, you have to put your left hand on your left eye. So you have to tell how much this.
2, 4.
Okay, so on the another hand. Okay, you have to tell how much is this.
2, 2.
Yes. Okay, so after that I will check her perla and the accommodation. To check the perla, you have to see towards the wall, and I will check her pupils. You have to see straight forward towards the wall. Okay?
Okay.
Okay. Is shows that her pupil is fully reacted to the light and symmetrical and equal in size. After that, I will check the comfort accommodation. To check the accommodation, you have to see towards the wall and towards the pen. So with the instructions, you have to watch there. Okay. So when I will say towards the wall, you have to watch there. When I will say towards the pencil, you have to watch here. Okay. Now the distance should be 30 to 40 centimeters from the eye and the pencil. So now, can you please see towards the wall, to the pencil, to the wall, to the pencil, to the wall, to the pencil. Okay. So after that, I'll check the facial nerves. To check the facial nerves, can you please close your eyes? Can you open your eyes? Close your eyes tightly. Okay, can you open your eyes? Can you show me your teeth? Can you make a smile with teeth? Okay, can you make puff? Okay, it shows that her cranial nerves are intact and she is fully oriented with time, place and people. And she is fully conscious. I didn't see any abnormality with the cranial nerves. And after that, I'm gonna move to the respiratory assessment. To do the respiratory assessment, I just check her respiratory system. So for that, can you please take a deep breath? Can you hold it? Can you relax? Okay, it shows that her lungs are fully reflection and retraction and fully we can see the reflection and contraction of the lungs. So I have some questions that I'm gonna ask from the patient. So do you have any difficulty while breathing?
No.
Okay, it shows that the patient has a non-labored breathing. So after that, I'm gonna ask, like, I will check her lung sound. To check the lung sound, I'm gonna mention here there are the 5 regions in the anterior side and the 8 in the posterior side. So I'm gonna check the regions to check the lung sound. The right side of the lung, that is the apex. Then second intercostal space of the lung. Can you take deep breath? Fourth intercostal space of the lung. Can you take deep breath? Can you take deep breath? Sixth intercostal space. Mid-axillary line. Okay, now the posterior side. Okay, I'm gonna start from the apex of the lung. Can you take deep breath? Can you take deep breath? Okay, now the shoulder bones. Can you take deep breath? Can you take deep breath? Can you take deep breath? Okay. Okay. So now I didn't heard any abnormal and murmur and dorsal sound. So her lung is her lung is normal and fully contraction and reflection. So her interior and posterior transverse diameter is 1:2. After that, I'm gonna do the cardiac assessment. To do the cardiac assessment, I have just question that I'm gonna ask from my patient. Do you feel any anxiety?
No.
Okay. So I'm gonna sound aortic sound on the right side of the heart, on the second intercostal space. On the third intercostal space, that is up sound. On the fourth intercostal space, that is tricapsid. And the fifth is that is mitral. And here I'm gonna put to listen the apex pulse for 1 minute. Her apex pulse is 82. That is total 82. That is normal. So after that I'm her S1 S2 is properly heard and normal. So I'm gonna do the abdominal. Can you please lay down on the bed? Okay. So I'm gonna check her abdomen from the posterior side, the abdominal girth, and from the side base. So her abdomen is flat. After that, I'm gonna auscultate. To auscultate, I'm gonna divide her abdomen into 4 regions. From right lower to right lower quadrant to left lower quadrant. To left upper quadrant to left lower quadrant. It shows that she has proper bowel sound that are 5 to 30. So after that, with the same way, I'm gonna do the palpate softly, not deeply. So right lower quadrant to right upper quadrant to left lower quadrant, left upper quadrant to left lower quadrant. It shows that there is no scars and lesions. So after that, I'm gonna do the extremities. Can you go there? Okay. Can you extend your arms? Okay. So there, the skin ruggedity is good. It's warm. There is no bruises and scars. Can you? Okay, nearly feel I'll do the nail capillary refill test for 3 seconds and do the radial pulse bilaterally for 1 minute. Okay, that is 82, as the same as the apical pulse plus 2. Can you? Okay. So there is no bruises and scars. Skin ruggedity is good and warm. Temperature is warm. After that, I'm gonna do the dorsal pedioff bilaterally. Okay, same as the radical pulse, that is plus 2, and the posterior tibia, that is bilaterally, that is plus 2, same as the radical. So here I'm done my head to toe assessment. So I'm gonna notify all the assessments. I'm gonna notify all the assessments to the doctor for her recovery. So my friend will do the 360 round of the room. Thanks.